Black people have always been a part of the advocacy movement in the HIV space, but not always as respected or welcome at the table. There has been a long push to create Black-led, Black-run organizations for the Black community, and sadly, the funding opportunities have not always been there to support them. We have seen many Black-led organizations around this country have to close their doors when funding has gone to white-led organizations who are serving predominantly white people. HIV is just one piece of the puzzle for Black folks. There are so many other social barriers to having a stable and healthy life. And when you're looking at whether or not you're going to access healthcare versus get food on the table or keep the lights on, HIV and or your healthcare may not be at the top of that list, especially when you know that it is a high likelihood that you could contract HIV in your lifetime and that you live in a time where there is a longevity with the disease if you're fortunate enough to have the appropriate access to the care and treatment that will allow that. I think there are incredibly valid reasons for Black folks to have mistrust of large institutions and, in particular, of healthcare. There are a variety of historic examples that show us that Black people's lives did not matter, that we weren't worth the same healthcare as our white counterparts, and that when we needed to advance medicine, that our bodies were disposable. And while so much has changed, that legacy lives on. And I think the history of Black folks and their interface with the healthcare system has a direct impact on how people are currently accessing HIV services. If organizations don't have Black folks that are working there, that are in the marketing materials, that are providing the direct services to the community, then it creates an additional barrier to folks feeling like it's a safe place to receive those services. Among Black people that I have known and lived and grown up around, there are many topics that we just avoid. And when you have an issue like HIV that is related to sex, that in many cases is related to sexual orientation, it becomes an even more layered and complicated discussion to enter into within your household or within the community that you're trying to navigate. There is still a very real stigma against being Black and gay. And there is a very real sentiment that if you are Black and identify as gay, that you will in fact be HIV positive. So that discrimination is very real. The stigma is living and breathing in the community every day, and many Black people are asked to leave their homes, the safety that they've created around them, and have to make difficult choices about how out they want to be about their sexual orientation or their HIV status. I learned of my own HIV status in March of 2004. I was an undergrad in college with the whole world ahead of me and a lot of excitement about what my postgraduate life might be. I really didn't think that in that day that I was going to walk away with a life-changing diagnosis. I had been very vigilant about getting tested and knowing my status and knowing the partners that I was with. And I remember sitting in a room and the HIV test counselor leaving to go read my result. I remember voices in the hallway and even remember hearing someone say, "Oh my gosh, he is so young." And me thinking, oh, that poor guy down the hall. I remember the lips of that HIV test counselor moving. HIV positive coming out of his mouth, a single tear running down my face, and feeling like the world was crumbling around me. And in that moment, I felt like my life was over, that there was not much I could do to navigate the world ahead of me, and was incredibly overwhelmed about what it might mean to tell my family and my friends, and whether or not I would still have a safe place to call home. I have a very close relationship with my mother. I remember the day that I learned about my HIV status. I had just a million thoughts racing through my mind. I also knew that I needed to rush back to my college campus because I was in a dance concert that evening. But my mother also has this amazing way of knowing when to show up. She ended up surprising me. She showed up at my college campus, wanting to surprise me on opening night of that performance. And while I had practiced in that drive home from getting my test result, all the ways that I might tell her, I was just so overcome with emotion that I cried in her arms, and I'm sure she was terrified because she probably also didn't know much about the disease that I was now living with. But she became my rock in that moment and has been my rock ever since. It took me a while to feel comfortable telling my friends and family about my diagnosis. I got connected to a group of young people that were attending national HIV conferences, and I went to one to learn a little bit more about the disease I was living with, and it was life-changing. I met a group of young people who were out and proud about their status, who were using their story and their face as a tool for advocacy. One of those people was this beautiful young Black gay man named Shelton. Shelton was a poet and an activist. He took me under his wing and helped me realize that I too could be a powerful force in a state like Ohio in sharing my story. I don't think there are many people who, when they're a little kid, say, I want to be the CEO of a nonprofit when I grow up. I was very involved in music and the arts, but after my HIV diagnosis, I needed to figure out what my new path in the world would be. And in that moment was also beginning to explore a community that had done so much for me. I got my first job out of being a volunteer for a local HIV service organization from an amazing man who became a good friend and mentor. And that first entree into working in the HIV nonprofit space launched a whole new career path for me. It is possible to end HIV in our lifetime, but it's not possible without meaningful involvement of Black people, not only when we need their input, but from a long-term relationship building standpoint. We need to build new bridges and find trust and respect, create opportunities for leadership and opportunities to break down generations of barriers, generations of valid distrust. And that will only be possible by bringing Black people into the fold in a meaningful and inclusive way.